Hi everyone, my name is Shamir, but everybody just calls me Shy. I am currently employed at a psychiatric hospital here in Delaware. I am an adolescent social worker. I work with adolescents ages 12 to 17. There are times when I do work with adults when the adolescent census is low. I do have experience participating in a treatment team. Monday through Friday, we hold treatment team, which includes myself as a social worker, the psychiatrist, charge nurse, and a UR person who is there for insurance purposes and making sure that the patients have covered days to remain in the hospital. Um, I have not participated in making the diagnoses. Typically, before I meet the patient, the psychiatrist sees the patient first, and when I get to them and do my social work role, they are already diagnosed with a diagnosis. So I have not participated in coming up with the diagnoses. Um, I do work with my psychiatrist and gathering collateral from schools. And if they have like an outpatient provider, I talk to the outpatient provider and get collateral information. If need be, I get past records from other hospitals or other psychiatrists and therapists that the patient may have seen. I work very closely with my psychiatrist. We have a good relationship, so I kind of shadow him a lot because I want to eventually learn how to create diagnoses or make diagnoses for individuals. Um, so I'm very excited to do this class, and I'm excited to learn how to diagnose someone and to go over the DSM-5 because I never really went over it. So for me, that's exciting. And then working in this field, I can practice some of the skills that I learned at class at work. It's nice meeting you all, and good luck in the class. I look forward to working with everyone.